I needed medical attention. At the time, I was unemployed. I was not able to get medical help. I was uninsured and with no possibility of paying for medical services on my own. I remember being in excruciating pain. I had several symptoms and surgery was necessary. I needed to see a gastroenterologist for my condition and perform various exams, and ultrasound was one of them. A consultation, evaluation, and diagnosis would have been extremely costly. It was a huge blessing for me finding Good News Care Center. They planned and accommodated the healthcare service that I needed. It was done at Baptist Hospital. The nurses and all the volunteers that were there cared for me as if I were a patient that was paying. They even kept me for another day because I had a severe reaction to the anesthesia. I am forever grateful. Had it not been because this clinic existed, I don't know where I would have ended up. I am blessed and thankful that the situation is now behind and it was solved. But just like me, the healthcare professionals in this clinic have impacted many other lives.
My parents worked for the Miami Baptist Association with the Haitian community, and I grew up as a missionary kid in Haiti. In 2002, my husband and we came to Homestead as church planners as a part of 4U Miami. We saw this clinic as a good opportunity to be involved in our community. I was able to volunteer and use my Creole skills as a translator and also visit patients in their homes with Mike. My husband and I qualified as a low-income family, and we were also able to receive care through the clinic. A few years later, I was thankful to become an employee. I'm very blessed to help the patients that do come to us. The clinic has made a big difference in my life, and it's incredible what they do.
Good News Care Center has been of great help for those most in need for over 2 decades, and now is celebrating its 25th anniversary. This completely free medical clinic opens its doors to men and women, specifically in the Florida City, Homestead, Florida areas, which are cities mainly fed by a network of agricultural communities where thousands of migrant farm workers live and have low income, no health insurance, and nowhere to turn for the medical care desperately needed. That situation was discovered through various health fairs and dental projects that revealed a true motivation to the founder of the nonprofit, Michael Daly, who had a dream in 1989 that became a reality 7 years later. Good News Care Center was founded in October of 1996. Its logo represents the good news of the gospel and the unity of all people, shown with the 11 human figures, men and women in the style of paper cutouts linking arms. Michael Daly is an ordained minister and associate director of church and community ministries for the Miami Baptist Association. He envisioned a center that would bring relief to the most unfortunate through top primary quality and specialized healthcare. With outstanding effort, perseverance, and the collaboration of many from the medical community and healthcare professionals, his vision became a reality.
The history of this clinic is very interesting. We have some particular situations that took place that I do think that set this one apart. And after doing a couple of those projects for a couple of years, along with dental projects, one of the doctors, his name is Dr. Tim Shackner, passed away many years ago, but he gave me a call and he said, we were really overwhelmed with the needs that we saw in that community. And what we'd like to do is establish a permanent setting for allowing medical students to earn their health education, and we can involve professors from the University of Miami Medical School to oversee that. And would it be possible, do you think, to share space with a church? And I said, that's a great idea.
But in 1992, Hurricane Andrew made landfall. That situation brought more hands from the medical healthcare field to the movement. And despite all odds, he was led to Florida City on March 17, 1996.
Hi, my name is Pastor Victor Hickson, Full Deliverance Baptist Church, along with the Good News Care Clinic. We're here to make a difference in our community. We work together, not only work together for our community, making sure that ones who do not have affordable health care, can't afford health care, that the opportunity as new members come in, I refer them to the clinic for services such as diabetes and high blood pressure. Once they get sent over here by Baptist, They will be able to come there for training how to treat themselves, how to diet, and how to help fight against diabetes. We care about our community, especially migrant workers who do not have any insurance. Therefore, they could be able to come and be serviced and see a doctor and be able to be taken care of. We're able to provide great health care. Doctors here to train, nurses are here, and we care about the patients who visit the clinic. We are here. We're not just existing. We're here because it's a ministry that's sent by God. So therefore, we're here to minister, to let them know that we do care. Yes, we do care. It doesn't matter what race, creed, or color. We do care about your health. And then once you understand that we really do care, that's our objective, that's our target goal, to let our community that's here for 25 years. Therefore, when a healthy community, we're teaching them number one, to live better, to love better, to serve better, and to give better. We're here to serve. And while we're here to serve, we want to make an impact here in Florida City, that we are here to meet the needs of our community. I want to urge others who really care about the community, and you don't have to live here in Florida City in order to give and to donate towards the ministry as well as the clinic, because we are making an impact in our community.
Numerous organizations shared their resources to be able to provide a level of care like never before. Grants like the Robert Wood Johnson Foundation, the Health Foundation of South Florida, as well as services donated by Baptist Health Systems of South Florida, and the Area for Health Education Center that includes students from various disciplines. supplied medical students and nurses. Baptist Health Systems volunteered doctors, nurses, and $1 million worth of surgical and lab work. Barry University supplied podiatrists, crucial for identifying diabetes and much more.
The director of pastoral care, named Reverend Bob Jacoby, contacted me and asked, Mike, is there something that you might be involved in, because you've done the health fairs and everything, where doctors could get involved? Talk about serendipity. I actually call it miraculous, because we were working on developing, several people, organizations were trying to develop this clinic setting, and at the same time, added another miracle. Got to hear about an offer for a major grant from one of the largest medical grant-making foundations in the world, Robert Wood Johnson Foundation. Robert Wood Johnson is the founder of Johnson & Johnson Medical Company. And so they had a special project called Reach Out, Physicians Initiative to expand healthcare access to the underserved in the United States. That was the name of the project. I'll never forget it, because it was just an exciting period. So we submitted a proposal. And that proposal also identified Baptist Hospital, and at that time, Baptist Health Systems, now Baptist Health South Florida, as being committed to this project and providing support, such as with laboratory tests and other diagnostic services to physicians, and other assistance, financial assistance for medical care for the patients in the hospital. And so we made it as a finalist. They had, as I recall, 39 finalists, and they funded 19. And later, one of the people in the National Program Committee told me that we were one of 614 applications from organizations throughout the United States. So this is a David and Goliath thing, except that we had our own Goliath, which was Baptist Hospital. So for the final phase, and this history is so important, because I am convinced beyond a shadow of a doubt, unequivocally, that if we had not received the grant from Robert Wood Johnson Foundation, this Reach Out Project grant, the Good News Care Center would not have opened. And if we had not had such support as we had, and commitment of support from Baptist Hospital, then we would not have received the Reach Out program grant. We received this letter. I received this letter saying that we needed to go to a site meeting in Texas to give a defense of our proposal. And they had 4 main questions for us. three of them dealt with the level of commitment on behalf of Baptist Hospital, Baptist Health Systems, and the physicians. And I was thinking, well, we'll go with our doctor, Dr. Yvette Lopez, and we'll tell him, yeah, everything we told you is true. And I was just reciting. We had 4 days to prepare, 4 days. And I was reciting in my mind what to do when I was in our bedroom, and my eye locked on this big VCR camera that we had that sits on the shoulder. You look like Channel 7 coming in. And I thought, I don't know what else to do, but I'm going to go see if I can interview those who have the authority to make these commitments. Dr. Yvette and I went to the Reach Out Program's site visit where we had to give a defense of the proposal. We had a panel of 4. And one of the members of that panel was Dr. Denman Scott, who was the National Program Director for the Reach Out Project, which was kind of amazing. So when I put in the video, I thanked them for allowing us to come, for receiving our proposal and giving us this opportunity. And I said, I have a video I want to play, and they have the equipment there. And I said, these people you'll see on the video can tell you a much better way than I can exactly how this is going to work out regarding these questions that you have for us. And I will say this, that when Brian Keeley popped on the screen and said,
My name is Brian Keeley. I'm president of Baptist Hospital and Baptist Health Systems. We're very supportive of the clinic endeavor. We have approximately 200 physicians involved in our community service outreach program here at Baptist. When this opportunity came to our attention, our physicians were very enthusiastic in terms of their participation. Likewise, Baptist is very enthusiastic. This gives us an opportunity to exercise our corporate mission to care for people who are the disadvantaged people in our community, and to bring our full resources to bear on a problem that is occurring in our community.
Now, Dr. Denman Scott had a pen in hand, as the others did. He put his pen down, and he leaned back in his chair, and he had kind of a smile on his face, and he just listened. And when he did that, I thought, yes, we got this grant. And we did. Now, I would consider all that to be not just serendipity, but miraculous. We would deeply appreciate any motivation that you have to join us in our work and to help us at any level.
Moises Robina, chaplain of Good News Care Center, started Iglesia Batista Mi Ebenezer by visiting the patients in their homes. This is his testimony.
De forma especial, yo tengo mucho que agradecerle a esta clínica porque en el año 2012 a mí se me presentó una enfermedad llamada acalasia, que no podía tragar, que la operación no fue valorada en $29,000 y por la gracia de Dios yo no tuve que pagar nada. Siempre mi ministerio es poder lograr que las personas conozcan a Jesucristo, porque lo material pasa, pero lo espiritual permanece. Pastor Mark Daly, junto con su esposa Ana, y las enfermeras y todo el personal de esta clínica, nos haya facilitado la oportunidad para ayudar a tantas personas necesitadas.
The administrative position requires organization, follow-up, integrity, and order. Such an important role is crucial in reaching out to the needy in this capacity, and this exclusive and important task is performed by none other than Anna Daly, Michael Daly's wife.
Well, let me tell you, I'm so delighted to talk about my wife, Anna, especially in the context of this clinic, certainly in the context of our family. To start my conversation about Anna, I would like to refer to both the mission statement and our biblical-based core values. Believing in the worth of all people as created by God, the Good News Care Center strives through collaborative partnerships to provide free access to primary care to those most in need. And our biblical core values are from the Apostle Paul in the book of Galatians, chapter 6, verses 2 and 9, bear one another's burdens, and thus fulfill the law of Christ. And let us not lose heart in doing good, for in due time we shall reap if we do not grow weary. Now, Anna's been part of this clinic for 22 of its 25 years. She's done some incredible things of arranging specialty visits for people who suffer from all kinds of illnesses, and that's what we exist for. And the people in the system know her very well and like working with her, so she has direct contact. We talk about collaboration. Anna collaborates very well with through all the channels. And Anna dedicates hours, and has for many years, hours of time in making arrangements, filling out all the documents and everything that's necessary to obtain the prescription drugs for our patients. Virtually every patient in this clinic has some of their prescriptions coming through the patient assistance programs. It's a whole nother room with a section of the pharmacy, pharmaceuticals, and over the years, literally millions and millions of dollars. Anna has accomplished all of that. I'm very thankful that Anna has been able to commit herself to this work. This work has been right for her, and she's been right for it. And she works along with the doctors, with our doctors, to help keep these patients going straight and cooperating and being compliant with their medications and making their appointments. But she can be firm, and the patients don't want to have an Anna visit. I don't either. But if they get an Anna visit, then they know that they need to do what it is that she and our doctors want them to do. And I have seen many cases over the years where that's been the situation, who have improved their blood sugar, improved their blood pressure, have improved in diet, and not only a longer life, but a higher quality of life as well. And we're just grateful that we can accomplish that on behalf of these people. And Anna leads the way in getting that done.
In its 25 years of existence, Good News Care Center has been dedicating itself to excellence and has worked above and beyond the call of duty, causing an outstanding impact on South Florida's healthcare community, and is a beacon of hope and possibility to those most in need.